Welcome everyone to this CMP webinar series. I'm Claire Relton, co-coordinator of CMP, along with Jacqueline Lucas, who's with us as well today. I have the privilege of welcoming Josh Noseworthy, who is the founder and CEO of Global Conservation Solutions. GCS helps teams to deliver and accelerate impact for the natural world, and today's webinar focuses on reviving focal value or target health. So we're reclaiming the most misunderstood step in the conservation standards. And without further ado, Josh, I'll hand over to you and I'll stop sharing.
Thank you very much. I have deja vu right now. So we did this session yesterday. Hopefully, hopefully second time around will be even better. All right. So first of all, thanks everybody for joining today. Really appreciate it. We know you're all very busy professionals. So I do really appreciate you carving out the time to join me. As Claire said, my session today is called Reviving Focal Value Health. You can see my screen, yeah?
Yes, we've got it.
Okay, perfect. And as she also mentioned, my name is Josh Noseworthy, founder and CEO of Global Conservation Solutions, originally from Eastern Canada, although I'm zooming in with you today from Cuiabá, Brazil. And it is very, very hot. So if you see me sweating and twitching, I'm okay. But I might need to take a couple water breaks on the way here. Um, Going to dive right into our session. Hopefully, we'll carve out some time at the end for some discussion. Of course, we are talking about the conservation standards, which needs no introduction with this group. But I do want to jump into the purpose of the conservation standards, which is adaptive conservation. It was designed for us to be able to answer the following questions. Are we doing the right things? Are we doing them well? Another way to reframe that might be, could we be doing them better? Room for improvement? And ultimately, are we achieving our desired impact? That last question is oftentimes a very difficult one to answer, and it requires some planning steps by design to A, be able to articulate what that desired impact is. And so that really ties into the focal value health step, setting a baseline so that we can actually say what we want the health of our focal values to be in the future. So while we are going to be addressing the specific step within the assess phase of the conservation standards, looking at focal value health, and I guess just for clarity, I'm using the term focal value as reflected in CS 5.0, but that is synonymous with targets, which I know we have all been using for a lot of years. So just so you're aware, I might even slip up a couple times and use the word target. I did yesterday, but I'm going to do my best to really focus on the updated language and use the word focal value moving forward. So when we talk about focal value health, we're talking about the ecological integrity or the viability of the focal values within the geographic scope of the plan. The whole purpose of this step is to set a baseline so that we can actually generate evidence as to whether the health of the biodiversity and human well-being values that we're generating a plan around is actually changing in response to the actions and strategies that we're implementing. So that's the whole purpose of this step. It's the only purpose of this step, setting a foundational baseline so that we can actually say, based on evidence, that our actions and strategies are effective at improving the health of biodiversity and human well-being, if that's part of your plan. So without that clear baseline of health, we can't actually monitor whether we're achieving success for the biodiversity and human well-being that we claim to want to conserve and restore as part of the plan. And it is therefore not adaptive management. So this is really kind of spoiler alert, the take-home message, and I'm going to come back to it at the end of the session today. We need to be careful. We often are trying to leverage the brand that is the conservation standards, and I get it. But there are some really key steps that are needed to maintain the structural integrity of adaptive management, which is what the conservation standards was designed to achieve. One of those is setting a baseline so that we can actually say whether we are moving the needle and changing the state of nature. So if we go back to our definition, focal value health is defined as the ecological integrity or the viability of the focal values within the geographic scope of the plan. Before we can really get into the details on how to do this, we have to have a shared understanding of what we mean by focal values and what we mean by geographic scope. These are both critical steps that need to be developed in a way that can actually feed into an effective focal value health assessment. So let's start with scope. When we talk about scope, of course, within conservation standards, there's the thematic scope. I'm really focusing in on geographic scope right now. This is a really critical piece so that we can actually establish a shared understanding of what the focal value health is. So when we talk about geographic scope, we're talking about the clearly defined boundary or boundaries within which the plan is intended to have a positive influence. So we have an example here of a scope map. Basically, the area in green is where this planning team has made a decision. This is where we want to have a positive influence for whatever biodiversity features and human well-being features, and in this case, indigenous cultural features that the plan is going to focus on. There needs to be a shared understanding of where we intend to have influence. And it also, once we establish what biodiversity and human well-being and cultural values we're going to influence in this area, sets us up to be able to monitor whether we're actually improving the situation for those features in this area. So scope is such a critical step in this entire process, making sure everyone on the team has a clear understanding of the geography within which we want to have a positive influence. In this particular map, there's kind of a broader spatial scale here. It's situated within an indigenous traditional district called the Siknik Mi'kmaq district. But the boundary itself, the green area, which is a series of watersheds that have kind of been grouped together, is the clear geographic scope within which this team is going to implement their strategies and monitor whether they're having a positive impact. So why is this important? First and foremost, all conservation is spatial. And if you take one thing away from the webinar today, I hope it is this: all conservation is spatial. There are some conservation actions that are obviously spatial, like a protected area designation or an OECM, but even things like policy and education, awareness, social marketing, all of these have an intended impact somewhere, which by definition means that there's a somewhere else where they're not intended to have an impact. And so making sure everybody has a shared understanding of that where is so crucial. It removes the subjectivity, risk of misunderstanding as to where we intend to have a positive influence. And it is within this scope that we're going to conduct those focal value health assessments, because this is where we need to monitor whether that positive influence is being achieved or not. Confusion or subjectivity on where is just going to lead to inertia down the road. So setting this up very early in the process is only going to set you up for success in a more efficient planning process. It's not to say you have to have it right the first time, right? As we all know, this is iterative. And so conversations at later stages might require you to come back and reevaluate your geographic scope. That's not a failure of planning. That's adaptive management working well, right? So we shouldn't see that as a failure of planning. Sometimes we just need to iterate, and that's okay. But at the end of the day, there does need to be a geography clearly defined. Once we've identified the geographic scope, we can start talking about what biodiversity, human well-being, other values within that geography that we're trying to have a positive influence on, right? And I probably don't need to go into this in detail. This is probably pretty obvious to everybody on the webinar today, but when we talk about focal values, we're talking about the biodiversity features within the geographic scope, specific species, groups of species, ecological communities or ecosystems, as well as potentially biocultural features that the team is aiming to conserve and restore. So that can include local and indigenous knowledge, social institutions, spirituality, oral history, traditions, culturally significant sites or areas. All of these can be included as focal values in your plan if the team agrees that they require some sort of conservation or restoration attention. So if we go back to our scope example, this particular team, which by the way is made up of about 30 different organizations, federal government, provincial governments, several indigenous groups, NGO communities, and even some private sector industry groups. all working together to develop a collaborative plan within this specific geography. To define the focal values, we're just using some examples. They have a species focal value, the black-throated blue warbler. They came up with an ecosystem focal value, looking at streams and rivers. And because it's a watershed boundary that they've defined using their geographic scope, it actually does reflect an entire freshwater ecosystem. And also Mi'kmaq land and water use. So there is a traditional indigenous value being incorporated into the plan as well. So we're going to use these three focal value examples as we walk through the remainder of the presentation today. Okay, so we've established the geographic scope within which we intend to have a positive influence with the plan. We've defined the values that we want to influence positively within that scope. And now we can talk about how we're going to set that baseline to understand what the current state of those focal values is. So we're trying to answer three questions ultimately when we think about the health of our focal values. How do we define the health of a focal value? How do you define healthy black-throated blue warblers within that geographic scope? Or healthy streams and rivers within that geographic scope? Or healthy Mi'kmaq land and water use within that geographic scope? How do we actually measure that health? And ultimately, what is the current health now? This is really what we're trying to get at the end of the day, is a clear understanding of where we're at right now. Again, so we can set a baseline and determine whether that state of nature or human well-being is changing as a result of the actions and strategies that we implement. So ultimately, we want to rate the focal value health as being either very good, good, fair, or poor. And we do this by capturing the current state of knowledge on the focal value. And you can see that I've underlined current state of knowledge. We're going to come back to this. This is a really key component to an effective focal value health assessment. First, we define what a key attribute is, which is just a fancy way of articulating some important characteristic that can help us understand the health of the focal value. And then we want to identify the specific indicator that we're going to use to measure that health consistently over time. We define what very good, good, fair, and poor are in relation to that indicator, and then we figure out where we're at now. What's the current status? So if we go to our examples and we start with our species-based focal value, we have a black-throated blue warbler, oftentimes representing health assessments in these table formats with the stoplight coloring helps people kind of grasp them pretty quickly. It's great for communication purposes with a team. So on the left-hand side, we have the focal value itself. And the key attribute in this case is the population size. This is pretty common for a species focal value. Is the population going up or down over time? Indicator, in this case, is total number of breeding pairs. Hypothetically, there might be other ways to measure population size. Total number of adults, for example, and maybe others, right? So we just want to be really clear on what we're measuring, again, so we can do that consistently over time to track change. And then we need to define what poor, fair, good, and very good are in relation to that indicator. So in this case, the team said very good is greater than 50,000, good is 30,000 and 1 to 50,000, fair 10,000 to 30,000, and poor less than 10. Now, how did they get these values? Well, a good starting point is to use these generic definitions of our indicator ratings to help us think through a reasonable approximation of what poor, fair, good, and very good are. So starting with poor may result in extirpation without significant human intervention. Fair, outside some acceptable range of variation, requires human intervention. Good, within an acceptable range of variation, some intervention may be required for maintenance. And very good, the desirable status requires little intervention for maintenance. I don't really like these technical definitions, to be completely honest with you. In layman's terms, very good, slam dunk. Okay, this is where ideally we would like to be. And ideally is a key word. We're going to come back to that. It might not actually be realistic to get to very good, but we have some sort of evidence to suggest that this is where it was at some point in the past, perhaps, or it is just the ecologically desirable status that all else held equal, we wish we could achieve. Good is good. Probably could be better, but it's good. Fair, not doing so good, and will probably get worse if we don't take action. And poor, we're in the critical life zone here. if we don't take action, we're likely going to lose it. So using those as a bit of a lens on how to define the indicator ratings, how might a team actually fill in the specific numbers here? Well, maybe they have some scientific evidence of the historic population of black-throated blue warblers, and they were able to use that to define very good and then come up with these other values. Maybe they did some modeling and they were able to say, well, based on the available habitat in our geographic scope, we expect this number of breeding pairs to be supported, and they use that to inform their indicator ratings. Maybe they had none of that, and these numbers reflect a best guess by the team. All three of those options are equally valid if they reflect the best available information. And you're going to hear me really push on this throughout the webinar today. Best available does not mean best available scientific evidence. It means best available information. It is perfectly valid to have a rough guess as long as we are transparent that what we're putting in here is a rough guess. That allows us to make an assumption and therefore test an assumption and see how close or far we are from the reality. But without putting something into the plan to start on, we don't even have an assumption to test and build into the plan a strategy to improve on that information. So another big take-home message today is a best guess is still better than a blank page. We need to get comfortable with uncertainty. We're often going to be working in uncertainty, and we should not allow that to paralyze the planning process. And I'll come back to this several times in the webinar today. Oh, lastly, they were able to define the current status. And in this case, it's 2 years old. So the best they could do was back in 2023. Again, as long as they're transparent about that, there's nothing wrong with that. And so at 11,804 breeding pairs, the team knows that using the best available information as of now, we feel like we're in the fair category, which means it's not doing great and we should probably take action or it'll get worse. If we go to an ecosystem-based example, so our streams and rivers, in this case, the key attribute is the linear habitat connectivity. And the way they're going to measure that connectivity is the proportion of linear stream and river habitat that's accessible. In this case, poor was set as less than 60%, fair is 60 to 80%, good is 81 to 99%, and very good is 100%. Again, where did they get these values? Maybe they have some documented threshold of freshwater connectivity that has to be met to maintain, ecological function in their particular part of the world. Maybe they pulled these numbers out of the air because they felt they were reasonable approximations of what they think poor, fair, good, and very good are in the absence of anything else. Both equally valid if that reflects the best available information. The reality is that defining what poor, fair, good, and very good are is inherently subjective. There is no objectively correct answer to what these should be. So we're not aiming for what's right. We're aiming for what's reasonable and trying to inform those decisions with whatever information, evidence is available to us. So really, really important again, not to leave blank spots in your assessments. That serves nobody. It's okay to be uncertain and take a best guess and then test whether that assumption is true as part of the planning exercise. In this case, they were able to measure the current status right away. So this is probably a GIS analysis. And they learned that there's 86% of linear stream and river habitat accessible, which puts them pretty firmly in their good category. The definitions along the bottom are the same, so I won't walk through those again. And lastly, if we go to Mi'kmaq land and water use, in this case, the key attribute was access to blamu as a food source. Blamu is Mi'kmaq for Atlantic salmon. And the indicator in this case was proportion of elders that have access to blamu. Again, there's not going to be an objectively correct answer as to what poor, fair, good, and very good are in relation to that indicator. So the team chose what they felt was reasonable. And then they were able to define the current status, which was a survey conducted back in 2019. This is the best available information to inform the current status, which put them very, very firmly into the poor category, unfortunately. And by the way, this is a real indicator from a real plan. Again, and the definitions along the bottom, the exact same as before. So a few examples of how we actually go through a process of developing indicator ratings, current statuses with teams. When you're doing this, a couple considerations. We're trying to choose key attributes. Key is the key word. We are not trying to develop a laundry list of all the things you could measure or all the things you wish you could measure. We're trying to narrow this down to as few meaningful measures of health as possible, because somebody's actually going to have to pay money and spend time monitoring these things over time. So this is not an academic exercise, and it's often very useful to remind planning team members of this, depending on the makeup of the team. This is to inform action down the road. So focus on the need to haves, not the nice to haves. Try to refine this as much as you can. Selecting indicators that are efficient and affordable to measure probably goes without saying. We should try to draw from existing data sources wherever possible, existing monitoring efforts. The reality, though, in my personal experience, is that oftentimes even species and ecosystems that have been studied and monitored for decades do not actually have data that's fit for purpose to inform an action plan. And it's pretty common to go through lots of discussion with researchers who have been studying these things to talk about what data is available and realize there's not even some basic information on population or ecosystem size or condition. So it's often a bit of a massaging some existing data to try to fit our needs until we can come up with a monitoring process that's actually fit for purpose. And also to embrace the subjective nature of indicator rating definitions. I've said this already, and I'll probably say it again before the hour's over. Focus on what is reasonable. There is no right answer. And if you're aiming for perfection, you're going to fail, right? There's not going to be a right answer. We should expect that we're not going to get it right the first time, and that's perfectly okay. We're going to make some assumptions. We're going to test those assumptions, and we're going to improve over time as we learn and gain new insights. So dealing with uncertainty. As a community of practice, I think it's really important that we just get comfortable with uncertainty. It's inherent to what we do. We are working in one of the most complex contexts ever. We're trying to understand the complexity of ecology and biology of species and ecosystems, which themselves are changing all the time. Overlay on that the socioeconomic complexity and the interactions between these things. This doesn't get more complex. We're never going to have perfect knowledge. So if that's the expectation that we need perfect knowledge before we take action, we've already lost this battle against biodiversity loss. We really need to embrace uncertainty, get started, and learn from the implementation where we can improve over time. So don't let precision be the enemy of action. It's meant to be iterative. That's the beauty of the conservation standards. We can and should be updating these things as new information becomes available. I also really encourage coaches to not accept we don't know. To test assumptions, we need to make assumptions. So let's make some assumptions in the face of uncertainty. Be transparent that they are assumptions. That's also really, really important. We don't want to communicate that we have more certainty than we actually do, right? Be transparent about that. But there's a process that we can take to actually be transparent about that. And I'm going to come to that in a second. The reality, though, is blank spaces leads to inertia. And this is how plans begin to fall apart. So fill it in as a starting point, identify what needs to happen within the plan itself on how we're going to improve on that information. And then document those areas of uncertainty, as I've just said, build them into the plan as knowledge gaps to be addressed. There are confidence categories that we can use to consistently categorize how certain we are in the information that we're putting into the plan. So a rough guess, the indicator rating or current status is based on estimates from team members or others without specialized knowledge, often serving as an initial estimate to be refined over time. Expert knowledge, the indicator rating or current status is based on estimates from team members or other individuals with expertise to provide reliable information within the initiative's context or by extrapolating from similar projects. A rapid assessment, so information derived from project-specific data collected using simple methods, usually presence absence, categorical, or basic qualitative data, and intensive methods. Project-specific data collected using systematic methods, often including estimate of statistical precision. So I pulled these definitions directly from Mirati. A lot of teams, I think, and a lot of coaches may not even know that these categories exist. It's already baked into the system that there are going to be rough guesses as part of this process. We've even got a definition of that so that we can be transparent about these things. So I really encourage coaches to use this with teams. Oftentimes, the feeling of discomfort around putting a number in a box when we're not certain can be resolved by being transparent and putting that right up front. Hey, this is just a rough guess. It's a placeholder for now until we get better information. So that is, in a nutshell, the step. And I've got more content about common pitfalls, um, how you can actually roll up multiple key attributes to get an overall health of your focal value as a whole, and how you can even roll up across projects. We could talk about that. There's also a few slides on what the next steps are. Where does this information actually fit in to the next steps in the conservation standards and why it's so important? So I've got a few more things that we could cover, but at this point, I think we can just take a pause and ask if there's any clarifying questions about the focal value health step itself.
Great. Thanks, Josh. We don't have any questions in the chat. Becky is singing your praises in the chat, though. But if anyone does have a question, feel free to unmute or raise your hand and we can just dive in verbally. While we're waiting for folks to do that, I might jump in, Josh, with a question from
Hmm.
myself. So,
Sure.
um, when thinking about sort of common pitfalls, I know you'll get into this, but often what happens is we sort of schedule time for a week-long workshop to build a full strategic plan for teams. And then what happens is that you start talking about value viability and get to that point where you realize you potentially don't have the right people in the room. People don't want to make those assumptions. They feel like they might not be the right people to be making those big decisions related to different categories for viability.
Sure.
So, generally, what do you do in those sorts of cases? Do you have a separate workshop for target viability? Do you get people to prepare ahead of time to make sure that they bring that information to the workshop? How do you generally deal with that?
It's a really good question. I think there's probably no single right answer on how to deal with that. A lot of that, it kind of depends on like what the constraints of the project are and the budget. And if you've only got a week, um, in that example, if I knew we only had a week, I already know that a team is not going to be able to get through an entire process and have very firm indicator ratings, definitions, current status.
Mhm.
I think that is maybe one of the benefits of virtual meetings is having space in between to go and collect information and review things. We don't have some of that time constraint sometimes. Different approaches that I've taken is to have subgroups or subcommittees whose focus is on key attributes and indicators, and they're working in parallel to the other steps in the planning process. Because the reality is, we don't have to draw from the information that comes out of the focal value health assessment until 4 or 5 steps down the road in the plan. So these things can actually be going in parallel. You don't have to wait until you're done focal value health before you move into your pressures assessment. So that's one thing. If there are a few real keeners, you can set up those subcommittees and get them working on that right away. It usually does involve, though, going back to one of the first steps, which is the planning team, and saying, okay, what is the expertise we need to get the best available information so that we can make decisions on how we're going to populate this. Really important, though, I think it's important for coaches to communicate that it is not the expert's job to tell us what that should be. It is the expert's job to tell us what information is available so that we as a planning team can decide what is reasonable to populate that. It is ultimately the planning team's job because there is no right answer. So it's great to bring in experts. They can provide a little presentation maybe or share data. And often the truth is there could be a lot of handholding on the coach's part to help walk through that because of that uncertainty. Um, Sometimes, though, the best you can do if you only have a week is really rough placeholders. And it's about trying to convince people that this is just a placeholder. If we put nothing in here, this all is going to be a waste of time. So let's just put something, right? You can usually probably put some constraints. If we're talking about a population of black-throated blue warblers in that geography, and everybody has a sense of that geography, they live and work there, it's probably not 40 billion breeding pairs, and it's probably not one breeding pair. So let's just narrow down the bookends until we get to something that's reasonable, right? And now we have an assumption that we can test. So it might take a little bit of creative massaging on the coach's part to kind of get this discomfort neutralized a little bit, but nobody is going to be in trouble if they get it wrong, right? This is
Mhm.
about getting started on something and then improving over time. So I guess that's probably not a very satisfactory answer to your question, Claire, but it kind of does depend on the constraints as far as time, budget, those sorts of things. Ideally, you've got a group of keeners who want to take this on and will come back and present to the broader group for decision making.
Yeah, I've usually found that as well.
Okay.
All right, Erica, go ahead, and then we'll jump to Tom's question in the chat. Go for it, Erica. Where are you,
Yeah,
Erica?
I'm in I'm in the woods. Um, Josh, I was wondering what you what's your guidance to teams who want to put instead of actual numbers, more like better than a baseline when they don't have a baseline, or like these more qualitative kind of general statements for their viability analysis.
So I certainly have nothing against qualitative data. What we're trying to achieve is to remove any subjectivity into the definitions, though. So sometimes qualitative means it's up to interpretation about what any individual person could read those definitions and have a wildly different perspective about what that means. That's what we're
Hmm.
trying to eliminate the risk of. So qualitative in and of itself isn't bad. It's about being precise about the qualitative component, I think is really important. And wanting to put in the example like relative to a baseline where they don't have a baseline, I think the best I can answer there is a case by case basis. As a coach, I might make a judgment call about how serious they are in getting a baseline as soon as
Yeah.
possible versus
Hmm.
whether they're just trying to delay having to make a decision.
Yeah.
Um, I would take a different approach depending on my judgment call of which of those two scenarios might be playing out.
Hmm.
I think if there is a commitment to getting a baseline, then absolutely we can put a pause, right? But it's not a we'll just I don't know, we'll figure it out later. It's we're now going to this is what we're doing, and here's who's responsible for doing it to get the baseline, and then we're going to come back and populate.
And if there's, is there any other hands raised? Because I have a second question.
Go for it, Erica.
Um, we have a situation where we have a lot of growth, like where the scope is constantly being expanded.
Okay.
Um, I know that's a bigger challenge associated with planning and adaptive management, but maybe in context of these focal values, do you have any suggestions when the scope is kind of a moving target?
So what I'm going to say is coming from an idealized perspective. I like to start there and then say, okay, what are the practical realities? So from an idealized perspective, every time your scope changes, your health assessments should change to reflect the change in the area that you intend to have a positive influence. Um, and there are things you can do to try and set yourself up, especially if we're talking about large landscape scale plans.
Hmm.
Oftentimes we're relying on GIS analyses, and maybe you have some automated tools that you can just put the new data in that reflects the broader geography and still pump out those values. And I actually have an example of that I can show maybe later in the session today. So I realize there might be practical limitations in doing that, but from an idealized perspective, those should be in concert always. That if there's an update to the scope, the analyses that have informed the state of nature that we're trying to improve in that scope should automatically be part of that process.
Hmm. Hmm.
Otherwise, there's a disconnect, right? And we're setting
Right.
ourselves up to be monitoring the wrong things actually within the scope of the plan.
Hmm. Thanks.
Problem.
All right. And then our last question comes from Tom in the chat. Tom asks, one of the dilemmas we face in migrant bird conservation, like black-throated blue warbler, is, which is a good example, is that focal health could be related to actions in, sorry, I've got a sticker note over this. Sorry, in geographic areas, or related to conditions in a very different area, so non-breeding locations somewhere else. So any thoughts on this with regards to migratory species?
I was wondering if anyone was going to call me out on the migratory bird context, so I appreciate it because this is one that we commonly come up against, and it is a challenge. The reality is, when we set the geographic scope of a plan, we need to define indicators that tell us whether we're changing the state of biodiversity in that scope. So in the example of the black-throated blue warbler, it was actually a little cheeky of me to use this. Population size would be a terrible indicator because it's not within the breeding habitat that the black-throated blue warbler even has any concern. It's in the wintering habitat. It's the loss of tropical forests, right? So you can measure the population size within your geographic scope up in Canada all you want. The population could be declining, and it has nothing to do with what you're doing or not doing within your geographic scope. So how do we overcome that? Oftentimes, the best we can do, well, there's one of two options, and I'll give you some real world examples. We did a project with a seabird called Leach's storm petrel in Eastern North America. It was an international plan. And the team came to the same conclusion. Yes, we can do some stuff to increase fledgling success and try and stop predation on fledglings, but the reality is the population isn't being influenced by that. It's what's going on in the southern hemisphere. They made a decision, well, we're going to come up with what we can do now to improve the resilience of the population in Eastern North America, but we have to increase our scope to the globe if we're truly going to make a difference for this species. It's kind of a piss or get off the pot situation. That's the reality. And we either create a plan that reflects the reality or we accept that we just can't actually change the population size. It's just the reality we face. The other way to flip that is to say, we acknowledge we cannot influence population size. What we can do is ensure that the habitat in our geographic scope doesn't decline any further. And so you flip the key attribute in the indicator to be a habitat-based assessment because that's what you can actually influence. And you hope that the issues outside your geographic scope get addressed by somebody else. These are sensitive conversations, right? And sometimes we have to kind of give up a little on these things that we care about very much, but we have to look at them with two eyes open. There are certain situations where we simply can't influence, and we need to focus on what components we can. So the migratory bird situation is a really good one. Habitat is most often used in those cases, and we accept that we actually are not going to be able to say with confidence that anything we've done within our geographic scope has influenced the population because most of the time it's outside of this hemisphere where the true pressures are having a negative impact on those species. I hope that answered the question, Tom.
Yeah, tough question, but that's very helpful. And yeah, so focusing on habitat, the way you phrased it was really helpful. Thank you very much, Bruce.
My pleasure. I'm going to keep going. We've got about 20 minutes. I could probably get through the common pitfalls pretty quickly and then what the next steps are. I did have a section on rolling up multiple key attributes. It's really technical and into the weeds. Maybe we'll skip that one today because I would like to just have a little bit of time at the end in case people have additional questions or even some reflections from your own work. So common pitfalls. Selecting indicators that are impractical to measure or are so complex that no one's going to understand them. It doesn't matter how precise your indicator is. If nobody understands it, it's useless. And I'm going to provide examples of each one of these common pitfalls. This one makes me laugh every time. This is a real indicator that I was able to talk a team down from. Proportion of the forest that is old relative to expected historic area of old forest based on adapted median of the natural range of variation averaged across respective ecodistricts. The reality is the people who came up with this indicator couldn't even articulate to me what this actually meant on the ground. So this is not a useful indicator, regardless of how statistically precise it might be. No one understands it. It's not going to inform action. So try not to make complex indicators. As Nick and Richard, I never know how to pronounce his last name. Is it Margulis?
Margolius.
Margolius and Nick Solashki in their book, they talk about not needing the gold standard all the time. The aluminum standard often works just fine for our purposes, and I love that analogy. We don't always have to aim for these perfectly precise indicators. In fact, we might actually be doing ourselves a disservice by focusing on that when something simpler will work. Selecting indicators that measure relative change rather than absolute change. This is a bit of a pet peeve of mine, I will say. Now, I want to come out of the gate saying there are situations where trend is an appropriate indicator, but trend can actually mask the reality of a situation. So, for example, we have a target or a focal value, called blue iguana. The key attribute is population trend. We're looking at average annual rate of change in the population. And in this case, they're saying, well, a stable population, so a percent change of 0, is going to be the lower limit of our good category. And then if we see a slight increase in the population up to 0.2%, we're going to still consider that good. Anything greater than that will be very good. Seems fine at first glance. But the reality could be we have 1,000 blue iguanas right now in a stable population. 900 of those disappear. So a 90% reduction in the population. There's only 100 left. But when that population stabilizes at 100, we're back to a trend value of 0, saying that we're in a good situation again. So we have to be careful about using trend. We could lose 90% of a population of a species that's endangered. It's still come out as good if we're saying stable population is what we're aiming for, right? In reality, an actual amount, looking at actual population size, would allow us to track that change consistently over time. We started with 1,000, now we have 100, right? Red flags, we got to do something. So all else held equal, using absolute numbers will provide a better indicator than trends. Again, there are specific situations where trend might be better, but it tends to be quite rare in my experience. Selecting indicators that are not sensitive enough to meaningfully detect change in focal value health over time. Maybe we have a focal value called coastal fog forest. It's an ecosystem focal value, and we're trying to measure air quality. Well, often when we do things like this, we're trying to figure out indicator species, and lichens are often touted as a great indicator species of air quality. So we came up with an indicator of the proportion of 10-meter grid cells with the purple fog lichen present. So if that number of grid cells is going down over time, we assume air quality is going down over time. You need to be really confident that there is a direct correlation between the population of this purple fog lichen and air quality to really put your eggs in this basket. If there is anything else that could be affecting the population of purple fog lichen, maybe some species that feeds on the lichen, maybe its own internal fluctuation in population over time, right? You could be measuring this and seeing a change in purple fog lichen that has absolutely nothing to do with air quality. So you really want to be careful and ensure that if you're using things like indicator species or any sort of surrogate indicator that goes beyond measuring the attribute itself, that there is clear evidence of a direct correlation between those two things, or you could end up spending time and money trying to solve problems that don't actually exist. Designing indicators that measure the current state of negative impact rather than the current state of health. This is a little bit more nuanced. In this example, tropical dry forest is our focal value. We're looking at the condition of the forest, and the indicator is the proportion of tropical dry forest sample sites with invasive species present. We don't want to measure the degree of the pressure. We want to measure the health. So we actually want to flip this on its head and measure sites with invasive species absent in this example. Another example, if we're looking at total area of tropical dry forest, the indicator is not area of deforestation. we're not measuring deforestation. We're trying to measure the area of the forest. And the area of the forest might be going down as a result of deforestation, but it's a measure of health of the focal value itself, not the pressure having a negative impact. This plays out in many different ways later down the road within the CS process. So sometimes it could be innocuous, but sometimes it can actually lead to some really big issues later down the road. And so best to just do it from the beginning. Make sure you're framing the indicator as a value of health and not of disease or pressure, because we can't always see 6 steps down the road how this is going to play out. The next one, having overlapping values in your indicator ratings. This one's pretty minor, but as coaches, it's probably something we should be on top of, right? If your fair category here is 500 to 1,000 and your good category is 1,000 to 2,000, but you have a value of exactly 1,000, is it fair or is it good? Right? Well, this should probably have reflected the difference between the two. I see this all the time. Again, it's pretty minor, but it's also very common. Just something for everybody to keep in mind when you're developing these. Developing indicators that measure the outcomes of strategies. This is a really common one. Proportion of an ecosystem in a protected area. This is not a measure of health. A protected area might be a strategy or action that helps to improve the health of the palm savanna in this case, but it is not in and of itself a measure of health. Ask yourself, what are we trying to do in relation to palm savanna by establishing a protected area? It's probably to maintain the current area, no further loss of palm savanna, perhaps, right? Because habitat loss might be an issue. Maybe it's to maintain a certain condition of the palm savanna, but those are the measures of health, size, condition, whatever. And that's what we should be measuring. The effectiveness of a protected area is like 6 steps down the road when we're developing actions and strategies and evaluating their effectiveness by setting objectives, right? That's not at this stage. We're trying to have an understanding of the state of nature, not whether a particular designation or a management regime or a policy has been overlaid on top of the focal value. So this is a really common one and one that I encourage us to push back on. What state of health are you trying to maintain or improve? In this case, by establishing a protected area, the answer to that is the indicator that you should be measuring. Filling in current status for each indicator rating instead of having one value. I've seen a few plans that are framed this way. So just a complete misinterpretation of what the step is intended to achieve. And so in this case, they're looking at coral reef within some condition index value, and they populated the area within the ranges rather than saying proportion of the coral reef that's in, an index value of 0.91 or greater. Framing this in some way so that there is a single current status. This is really important for when we feed into the next step where we draw on this information. We don't want a value for each one of these indicator ratings. Each health assessment should have one current status. And then lastly, talked about this before, letting uncertainty paralyze the planning process. Don't leave blanks. A best guess is still better than a blank page. So those are some common pitfalls. I'm going to keep rolling here past the rolling up of KAs because this is really technical stuff. But if anybody's interested, you can email me afterwards and I'm happy to send this deck and you can take a look at those. What I do want to talk about is goals. So the goals step is where we actually draw on the information generated during the health assessments. And when we talk about goals, of course, as we know, goals are meant to be smart statements of the desired future health of a focal value. They are not vague statements of what you hope to achieve. They are not claims of better research or monitoring. They are one-to-one relationship statements that embed the indicator from the health assessment into a statement of the health that you want to achieve in the future. I can't reiterate this any stronger. Anything less than this is not adaptive management. There has to be a one-to-one relationship between the baseline that we've set and the definition of success for the focal values. So it should be specific, measurable, achievable, results-oriented, and time-bound. We choose one of our focal values, select a key attribute to begin with, write a draft description of the future desired condition, apply that 5 SMART criteria, and then modify as necessary. So if we go to our black-throated blue warbler example, we recall we had a current status of 11,804, which put them in the fair category. An example of a goal that meets that 5 SMART criteria. By 2050, the total number of black-throated blue warbler breeding pairs has increased from 11,804 to greater than or equal to 30,001 within the Pretendia watershed. Given Tom's call out that this is a migratory bird, let's just pretend it's a resident bird for the purpose of this example. This is not a good goal in reality because of the nature of it being migratory, but let's pretend it was resident. In this case, we're actually trying to improve the population. There is a one-to-one relationship between the indicator of health and the measure of success as stated in the goal. Similarly, streams and rivers. The indicator of health here was the proportion of linear stream and river habitat accessible, and we're currently at 86%. Example of a goal, by 2028, the proportion of linear stream and river habitat accessible will increase from 86% to 90% or greater within the Pretendia watershed. This meets the criteria. It's specific. We've named the target, the focal value, streams and rivers. We've named the geography, Pretendia watershed. It's measurable. We have a to and a from value that draws directly from the output from the health assessment. We'll assume the team said that this is achievable. It's a bit more subjective, but it's a conversation that needs to be had. It's results oriented. In this case, we're seeing an improvement. It's still within the good category, but this is an improvement in the state of the streams and river focal value. And it's time bound by 2028. You can copy this goal statement from this document, paste it somewhere completely external, and somebody who's not even part of these discussions can read this and still know exactly what it is you aim to achieve. There is no room for subjective interpretation, and that's what we're trying to achieve here. Everybody needs to have a shared understanding of how we're defining success, and that's why the goals process is so important, and that's why the health assessment process is so important, to set the baseline so that we can compare over time whether success is being achieved. I hope I've been able to communicate that clearly. Lastly, Mi'kmaq land and water use. Our indicator was the proportion of elders that have access to Blamu, currently very poor at 2%. An example goal, by 2035, the proportion of elders that have access to Blamu will increase from 2% to 80% or greater within the Pretendia watershed. Literally copied and pasted the indicator into the goal statement. So that one-to-one relationship is clearly there. Very, very important. So we only have a couple minutes left. I'm going to skip over these considerations around goals because I think you got the point. And I'm going to jump to my take-home messages, and then hopefully we'll have at least a couple minutes for questions before we got to wrap up. I'm going to give you a little bit of a warning that my take-home messages are going to come on a little bit strong. Okay, so you've been warned. It is both an art and a science, developing these health assessments. And while it can be very challenging and tedious and frustrating and time consuming, it is foundational to maintaining the structural integrity of an adaptive management plan. It's one thing to leverage the conservation standards as a brand, but if we're not actually doing these steps, or we're postponing them or approaching them superficially, you're not doing anybody any service by calling it adaptive management and conservation standards, because you will not be able to generate the evidence as to what's working and what's not for the nature and human well-being values that we claim to care about. Okay, this is not a matter of opinion. It's just how adaptive management works, whether you're using the conservation standards or some other framework. We have to establish baselines. So if we can't track that change in the state of biodiversity or human well-being as a result of the actions and strategy we implement, it's not adaptive management. And you know what? That's okay if that's the case and a team says, we don't want to do this, it's too hard. It's not your job to convince them otherwise, but as a coach, it is your job to articulate the trade-off in that decision. Okay, you don't want to do these health assessments, perfectly fine, but let's just acknowledge that if we don't, we're not going to be able to generate the evidence as to whether what we're doing is effective. So let's be transparent about that. There's nothing wrong with that decision, but let's call a spade at the bare minimum. No conservation plan ever created had perfect knowledge. And if that's what we're aiming for, we've already set ourselves up for failure. We need to get comfortable with uncertainty. And the reality is, and more than 400 organizations that I've supported in developing these plans, it's oftentimes the academic community who holds us back from being able to make decisions and move on. This kind of uncertainty about putting a number up there if we don't have clear evidence or a scientific article that we can reference. There's a lot of discomfort, and I totally understand why. But to make meaningful progress, acknowledging we are in a biodiversity crisis, we have to get started and trust the conservation standards process is going to give us the knowledge over time to improve on this information, continuous learning, continuous improvement. A rough guess is better than a blank page. Focus on what's reasonable, not what's right. And ultimately, like I said, we work in a crisis discipline. We need to get comfortable with uncertainty. We can't test assumptions unless we make assumptions. So let's get comfortable making assumptions and being transparent that that's what they are. 3 minutes left. A little thank you. A lot of you may have seen this in the CCNet listserv, but I just literally launched a book this week on the beginner's guide to the conservation standards, step-by-step guide. It includes everything we've talked about in the webinar today and the focal value health assessment chapter, but a lot of other tips and guidance from my own personal experience as well. So you're welcome to download the PDF version of that for free as a little gift. And thank you, everybody. I think we can probably squeeze in a couple of questions before we close out.
Brilliant. Thank you so much, Josh. Any questions from anyone? Any questions for Josh? You've obviously done such a good job of explaining everything. There's no questions.
That or
I have another one for you, though.
okay, great. Yes.
So I might jump in there. I'm sure you've had cases where teams have found it exceedingly different, particularly when you've got thematic-based projects. Teams often find it really difficult to assess target health for things like vultures or large, wide-ranging migratory species, things like that. So have you had lots of cases where teams have used the threat reduction objective as a proxy for their goal?
I can say I have talked every team I've worked with down from that approach and have convinced them to take a health assessment approach. I won't say that every one of those health assessments were perfect, but I think at least got them on a road towards thinking about how we're actually going to generate evidence as to whether the vultures or the wide-ranging mammals are actually benefiting over time and not making assumptions because of a pressure reduction.
Mm-hmm.
Because sometimes those things are not one-to-one.
Of course.
So it is, again, sometimes these things are challenging, but I've yet to come across an example where it was impossible to come up with some sort of measure that we can't improve on over time. Wide-ranging mammals is a great example, actually, if I can just jump in. So,
yeah.
with GIS these days, there's so much more available to us. And I know not every coach has a background in spatial analyses, but it is something I think we should all be working on, improving our geospatial skills, because it opens up a whole new world of monitoring opportunities, stuff that if you're not in that world, you probably can't even conceive of. So we can use landscape connectivity indices in GIS to get an understanding of fragmentation for wide-ranging mammals and the degree of connectivity and all of these things. So there often are some low-hanging fruit opportunities, but we might just not be exposed to those. So the more we can educate ourselves on what those opportunities are and then communicate those to teams opens up more opportunities to having something that's very directly measuring the impacts to the focal values themselves.
Mm-hmm. Great answer. I mean, when I was thinking about that, I was thinking particularly about teams that are focused only on addressing one particular threat. So they might focus only on trade, or they might focus only on power line collisions or road infrastructure or something. So they are working really hard on addressing and mitigating one particular threat, which means that they may not have the sort of experience or expertise to be tracking all the other threats that might be interacting with those species. And in those particular cases, it can be exceedingly difficult to monitor both the threat and the focal value at the same time.
I guess there's no as a coach, we're not trying to convince anybody of anything, like I said.
Of
But
course.
as a coach, I think it is our job to articulate the trade-offs in decisions that need to be made. And
Hmm.
one of the trade-offs in that example, you have a thematic focus on trying to reduce power line collisions. What if we spend $1 million in reducing power line collisions and it doesn't actually change the situation for vultures? Are we prepared to accept that outcome? If the answer is yes, let's keep going. But if the answer is no, then we have to actually see whether the vulture population has responded to our strategies to reduce collisions with power lines. Otherwise, this could be a complete waste of time and money, right? So
I guess if you've got a pilot study that's been done somewhere else and they have done that proof of concept, and you know that your strategy works, and you're trying to sort of implement the same strategy in another landscape, and you've got that sort of proof of concept in a similar environment, potentially then you could think about assessing just threat reduction. I don't know.
again, if that's the decision a team wants to take, that is their prerogative.
Mm,
And in no way would I try and tell them what they should or shouldn't do. But all else held equal, I am going to explain a trade-off of what if we don't
of
measure whether
course.
the state of the focal value is changing, we are leaving some big gaps as to whether what we're doing is actually effective or not. And that might be okay. And a team's comfortable with that. That's ultimately their choice.
Mm. It's been interesting conversations, and I would absolutely agree with you. It can just be that challenge to sort of move things forward. Okay, I'm going to
Yeah.
wrap up just after Jim's question. So if you
Okay.
don't mind staying on for one more minute, Jim's asking how best to proceed when we don't have things like population data. And one of our goals needs to be that it's to actually go about getting that data. So how can we phrase the goal so that it's smart and not too squishy? E.g., by 2035, we will have sufficient data to estimate population trends or habitat needs, etc., of species X, sufficient to inform conservation action.
So I'm going to take a hard line here that doesn't meet the definition of a goal. You might have an action or a strategy to go collect some information to inform a knowledge gap, but a goal is a statement on the future desired health of a target. So if you don't have population data, and oftentimes, by the way, we just don't, that data doesn't exist, uh, a rough guess, trying to get some, if there's experts on that species and trying to get them to help within a range of what's reasonable. It's probably not 1 billion, but it's probably more than 4. How close can we get in on the boundaries to get something reasonable as a starting point and then build an action into the plan to improve on that data? But these don't, I think this is actually a bit of an issue when we have kind of like what we call a goal reflects an improvement in knowledge or setting up a monitoring program. Those are actually activities that have to take place. They don't reflect an improvement in the health of the target. And I think those definitions are really important to maintaining the structural integrity of an adaptive management plan. So it's not to say that isn't critical. There has to be a way to actually get the data we need to improve on it. But that it should probably be couched in its own action. Maybe there's a strategy in the plan called improving our information to, I don't know, whatever you want to call it, addressing knowledge gaps, right? And then you've got a series of knowledge gaps that you need to address and you figure out how. But I think we should try to refrain from calling those goals. I think that might cause a little bit of confusion based on what the definition of a goal really is.
Ah, Jim says, good point. Of course, it's an action not related to the focal value. Alrighty, we're a little bit over time. Thank you for those extra few minutes, Josh. We appreciate it. And
My
thank you all for
pleasure.
being here today. It's been great to having so much engagement in the chat. So thank you all for that.
Thank you so much, everybody, for taking the time.